Systemic lupus erythematosus, commonly known as SLE, is a chronic autoimmune disease where the body's immune system mistakenly attacks its own tissues and organs. This can lead to widespread inflammation affecting various body systems, including the joints, skin, kidneys, heart, lungs, brain, and blood cells. Causes and risk factors. While the exact cause of SLE is unknown, several factors may contribute to its development. First, genetics. A family history of lupus or other autoimmune diseases increases the risk. Second, hormones. SLE is more common in women, especially of childbearing age, which is 15 to 45 years, suggesting a link with estrogen. Third, environment. Factors like sunlight, UV exposure, infections, and certain medications can trigger symptoms. And lastly, ethnicity. SLE is more prevalent in people of African, Asian, and Native American descent. Symptoms of SLE. SLE is often called the great imitator because its symptoms can mimic those of other illnesses. Symptoms vary widely from person to person, but common ones include fatigue, joint pain and swelling, a butterfly-shaped rash across the cheeks and nose, photosensitivity, fever, hair loss, mouth or nose ulcers, Raynaud's phenomenon, which is when fingers and toes turn blue or white in the cold, chest pain, when taking deep breaths, known as pleuritis or pericarditis, kidney problems, also called lupus nephritis, and neurological symptoms, like headaches, confusion, or seizures. Diagnosing SLE can be challenging due to its wide range of symptoms that overlap with other diseases. A combination of clinical examination, blood tests, and imaging studies is used for diagnosis. 1. Blood tests. The anti-nuclear antibody, or ANA test, where most people with lupus tests positive. Anti-dsDNA and anti-Smith antibodies are more specific to lupus. The complete blood count, or CBC, may show anemia, low white blood cells, or low platelets. Erythrocyte sedimentation rate and C-reactive protein indicate inflammation. 2. Kidney and liver function tests are used to assess organ involvement. 3. Urine tests. It detects the presence of protein or blood, which indicates kidney issues. 4. Skin or kidney biopsy. Sometimes it is used to confirm diagnosis. If not well managed, SLE can lead to severe complications affecting multiple organs. Kidney damage known as lupus nephritis, which can potentially lead to kidney failure. Cardiovascular disease, increasing the risk of heart attacks and strokes. Lung issues such as pleuritis, pneumonitis, or pulmonary hypertension. Neurological disorders like seizures, strokes, or cognitive impairment. And pregnancy complications, including miscarriage or preterm birth. Living with lupus requires a proactive approach to managing symptoms and preventing flares. Regular checkups with your healthcare provider. Being aware of triggers like stress, sun exposure, and infections. Maintaining a support system of family, friends, and possibly support groups. Systemic lupus erythematosus, or SLE, is a complex chronic condition that requires individualized care. With proper management, many people with lupus can lead full and active lives.